Hi, welcome to Doc Martin's quarantine video number 2. During this period of time where the clinics are closed, our people are constantly reaching out to our patients and our patient base. And the number one question that people have is, how can I help my lower back pain? Back pain is a very common problem. In fact, it affects 4 out of every 5 people around the world. There's even a saying that says, to be human is to suffer from back pain. This video is about providing you ways of helping your back pain from the comforts of your own home. In fact, 4 years ago, I injured my lower back. More like a self-induced injury, if you ask me. I was picking up those babies, okay? Well, more like lifting them. I was on the 82nd rep of a 32 kilogram jerk. And suddenly my back came crashing down together with the bells. I literally thought I had broken my back. And it was the most humbling experience ever. From being this incredibly strong person, I needed help to do anything. I needed help to get up and go to the bathroom. I needed help to just walk a few feet. I couldn't even go to work and work on patients. Over my 26 years of practice, I've met teachers who couldn't teach, parents who couldn't care for their children, and athletes who couldn't train or compete. Back pain is terrible. My injury was called a macrotrauma. So there was an event that caused my injury or my lower back pain. But most injuries are what's termed a cumulative microtrauma, which is the cumulative effect of stresses that are added up over days, weeks, months, and years. These stresses could be very benign, like sitting in poor posture, driving on a bumpy road, improper lifting, even improper sleeping. What this tells us is preventing back pain is about minimizing these stresses over time. Self-correcting your alignment is a good strategy to prevent major back injuries from sneaking up on us. This video is designed to help you assess your pelvic alignment and do simple home corrective care that can bring you less back pain. Before I share with you guys how to do this, I wanted you to make sure that you understand this does not replace the visit to a registered chiropractor or to a healthcare professional. These are simply techniques to help you mitigate the problems until you can get to one. Okay, let's get cracking! Okay, let's proceed to the second part of the video, the evaluation and the correction. Now I'm going to be needing my quarantine buddy, El Camara.
Hello again.
Okay, start by marching in place. Okay, and then stop where it feels natural or normal for you. Okay, from here we'll assess the level of the shoulders, compare the right with the left. Then we're going to assess the level of the hips, compare the right with the left. We're going to look at the position of the feet and then go from there. Okay, sit upright, okay, and measure the distance of the medial malleoli on the left and compare it with the right. The side that's closer to you is actually the side of the short leg where you start beginning to make the corrections. Please do that. Okay. Now, you take your shoe and you put your socks inside to give it volume. That way it doesn't compress when you put weight on it. And you do the same for the other shoe. You can use any type of shoe that you have, but it's best to use an Oxford-style men's shoe so it creates a wedge. Okay. Now, find your umbilicals or your belly button and your pubic bone, and what you want to go is halfway in between that. Off to the side, you're going to feel a bump. And that bump is called your anterior superior iliac spine. Directly underneath that is another bump, and that's called your posterior superior iliac spine. You're going to take one shoe, roll this here, and place it at the center of that bone, going in this direction. Okay. Now, then you're going to run your arm down the side of the leg, and you're going to come across another bump. This bump is called the greater trochanter. You're going to take your other shoe, roll this in, insert it at the center of that, pointing in this direction towards the other block. So one is pointing here, one is pointing here. And you're just going to do deep diaphragmic breathing for 2 minutes. Relax and enjoy the time as you use weight and gravity to gently realign your hips and your pelvis. I can't stress the importance of pelvic alignment. This area of your body is referred to as your core or your center, because if your center or your core isn't properly aligned, it affects everything below and everything above. Give it a try and let us know if these suggestions are working for you. Don't forget to hit like or subscribe. We will be releasing new videos every Sunday, videos that will help you improve your health and your back pain. Remember, every day, in every way, you are getting better and better.